Yes, hello there, Dr. Parvathy. Hi.
Hi, Dr. Dancy. Good evening.
Hello. Good
Yeah,
evening. How are you?
I'm good. How are you?
All good, all good. So,
Yeah,
how's everything in Chennai? How hot is it?
it's very extremely hot. I cannot explain that. Yeah.
Yes, it's sort of getting on here as well. Though we're like, no, not really to the coastal side, but yeah, not neither too far from these things. Yes, have you ever been to Davangere before?
Not yet. I would
Not
love
yet.
to. Next time, definitely.
All right, great. Yeah, Parvati. So, I think you can try sharing your screen from your end. I'll just give you some controls there. Yeah, me to the co-host. Yeah. Yes. All right. Yeah, can you try changing the slides just to see if there's any lag?
Yeah.
Yeah, seems okay.
Okay.
Okay, so we'll just leave it there.
Yeah.
Just wait for a couple of minutes, Doc, before we can start it off.
Yeah, sure.
Okay. I'll just put this. Yeah, this is already on YouTube. Let me just check on that. Yeah, it's going live on YouTube. Everything looks fine. All right. Okay, then we'll still have like 3-4 minutes. We'll just wait for students to join in, and
Yeah,
then we
sure.
can. Great. Okay. Yes. Yeah, Parvati. So, can you hear me clear?
Yes, Dr. Dancy.
All right. Great. Okay, then. Good evening, everyone who's connected with us on Zoom as well as on YouTube. Welcome everyone to PhD 101 National Level Rapid Revision Series. And as we're getting closer to the examination season, I think we've taken up topics based on requests from most of the postgraduates and undergraduates across the country. So today it gives me immense pleasure to welcome our speaker for the day, Dr. Parvathy, who's presently working as Associate Professor at the Department of Public Health Dentistry at Sun Memorial Dental College and Hospital. A little bit of introduction about our guest speaker for today. Dr. Parvathy has completed her master's from Savita University, 2013 to 16. So technically we're the same batch, Parvathy there. Okay, and she has done her BDS also from Savita University. And professionally, she's earlier worked at as a senior lecturer, and now she's presently working as associate professor at Sun Memorial Dental College and Hospital. Dr. Parvathy has many scientific publications to her credit. Her areas of interest include everything from dental care utilization to oral health status and the impact on oral health. She's also been given a lot of recognition in the ways of awards and prizes, from the Best Paper Awards ranging to the posters, and also the Best Social Dentist Award in the Department of Public Health Dentistry in Savita Dental College. So today we have Dr. Parvathy with us to brief us about a very important topic, which is again gaining eminence as the years pass and as we understood dental disease and the nature in a better way. And that is the influence of lifestyle and its concurrent oral health conditions. So welcome again, Dr. Parvathy. Thank you for agreeing to do this for us. It's really an honor to have you here. And it's so happy to see people connecting, and we really hope that this next session will be really helpful for all our students, especially the ones who are looking for exam-oriented questions and a brief overview so that they can quickly revise in this hour or so and use it for their benefit. So thank you so much for joining with us, and thank you so much for doing this. So with that little bit of introduction, I'd like to request Dr. Parvathy to please take over the proceedings.
Thank you, Dr. Tensi, for that warm introduction. I'm so glad that you called me to take over the session in PhD 101. And I'm so happy that, I got this topic of lifestyle and oral health. Can we start with the session now, or should we wait for some more time?
No, I think we're good to go, Doc. We're good to go.
All right, so let's start. Okay, all right. So good evening all. Hope you all had a good day, because now it's a session is from 6 to 7 and all will be, tired and all. I'm so sorry. And we have a vast topic to cover. It's lifestyle and oral health. And it's quite important when, it comes to the PG level. Let's start with the topic without much delay. Okay. So before I start with this topic, lifestyle and oral health, I would like to start with a quote that start with changing unhealthy habits to healthy ones and make them your favorites. So this means, you are making all your unhealthy habits to healthy habits to make a healthier lifestyle. So this is the summary of today's topic. So the contents of today's topic includes introduction, lifestyle variables, terms associated with lifestyle, lifestyle and oral health, which is our main topic, and the related literature, and a conclusion. So moving on to the introduction, lifestyle, what is the definition of lifestyle? So all of you will be looking at like the typical definition or the proper definition of lifestyle. We know what is lifestyle. It's a typical way of life of an individual, group, or culture. And the term is actually coined by a famous scientist, that is Lebensky, who is a psychologist, and also is being used by Alfred Adler, and he denotes it as the dynamics of the personality. So let me just explain furthermore with the lifestyle contents. So in simpler terms, it can be, concluded as the way people live. In colloquial terms, we can just say like how people are living with lifestyle, unhealthy and healthy behavior, adapting from the society. So the social environment has got an important role to play here, both the cultural and the behavioral patterns of the life. So now, Moving to the proper definition, that is from the WHO Health Promotion Glossary, it is defined as a pattern of living influenced by family, social history, culture, and socio-economic circumstances. So again, the exam point of view, I recommend you to go for WHO Health Promotion Glossary definition because that gives you more weightage and marks. So I would love to recommend this for you. And before we go further to the oral health and lifestyle changes, I would like to introduce with some terminologies associated with your lifestyle. So that includes your attitude, custom, belief, taboo, tradition, culture, habit, and behavior. So now you will be wondering, like, what is the difference between tradition and culture? Because that is a bit of confusion because we'll feel like tradition and culture is of the same meaning. So here, what I would love to see is that the tradition is one way which is passed through one generation to another generation. And the culture, on the other hand, is that it is acquired, and it's a group of communities acquiring a trait of behavior. They share a behavior. So this is tradition is from one generation to another generation. It is passed, and whereas the culture is not through the generation. So that's the main difference between both. Now, moving on to the lifestyle variables, it includes your personal hygiene, diet and regularity of meals, hours of sleep, physical activity, and personal habits like tobacco, alcohol, and drug abuse, then stress, occupation, and education. Now, the factors influencing lifestyle includes your family environment, tradition and custom, social, peer pressure, occupation, education, and environment. Now we'll see, before the start of the topic, let's see like how it is connecting with, the determinants of health. There is strong evidence that has been established regarding the association between health and lifestyle of an individual. For example, the health problems like coronary heart disease, cancer, diabetes, etc., are associated with lifestyle changes. And now when we see certain clinical variables in association with lifestyle, we can see like chronic diseases like diabetes. In some patients with diabetes, their routine itself is changing. That means their lifestyle is changing because they got a disease. So they are trying to improve their health. So it's got a connection with your clinical parameters or variables. And for example, in case of smokers, they are not adapting to a healthy lifestyle because they are all the time in a zombie world and they are not able to follow regular lifestyle patterns, and they will result in an unhealthy behavior. So this is the relationship between the clinical variables and the adaptation of the healthier lifestyle. Now let's see how it is related to socio-demographic factors. So that is actually women living with healthier lifestyle than men. So many literature has brought to notice that women scored better than men in health responsibility, nutrition, spiritual growth, interpersonal relationships, and stress management. And also we can see married subjects seems to be more healthier because they are focusing more on healthier lifestyle than single, divorced, or separated subjects. Now, moving on to the main topic. So these all were the brief introduction when we look at lifestyle and health as such. Now we are moving to oral health aspect. So here you have 7 parameters to consider. The first one is lifestyle and dental health behavior, then nutrition and oral health, then all the adverse oral habits, that is tobacco, alcohol and drug addiction and its relationship between oral health, then stress, and lastly, cultural practices and oral health. So we'll see one by one. The first one is your lifestyle and dental health behaviors. So here, Substantially higher proportions of regular dental visits are found to be higher in social class than in lower classes. So we can see when it comes to the social stratification, high income people will have sugar consumption more and then related changes in the lifestyle pattern. Now, the use of oral hygiene aids. So, we all know that irregular toothbrushing is associated with periodontal disease and also dental caries. Previous literature have conflicting results showing this, and there's reports showing that toothbrush to be having lower prevalence of caries, those who use finger. So all these are your oral hygiene aids related habits. So everything what we use daily related to cleaning your tooth and rinsing habits, everything is a part of your lifestyle. Now, moving to the frequency of brushing, data from number of countries, that is, they are, from many literature, it has been proved that those who start to brush before a year old, twice a day, or with parental involvement, doubles the odds of being decay-free, irrespective of the level of disadvantage. And a study conducted by Rajala et al. Found that the frequency of toothbrushing correlated negatively with sugar consumption among 13 to 19 years adolescents. And alcohol consumption has been negatively related with this. Now, indigenous aids. Indigenous means how we used it in the past. That is the use of chewing sticks and miswak. So all of these actually proved to be ineffective to improve your oral health, because many cross-sectional studies showed that higher plaque and gingival bleeding along with deeper pockets. So this has nothing effective for your benefiting oral hygiene. Like for example, miswak users, you can see severe gingival recession, and this leads to this unhealthy oral hygiene pattern. Now you have dental surface utilization. So remember, all these things are coming under your dental health behavior, that is your oral health and dental health behavior. So dental health utilization is those who use dental services regularly had less chance of getting into the dental caries and periodontal disease. Now, second thing is your nutrition and oral health. All this time we spoke about the oral behavior, and now secondly, we are going to talk about nutrition and oral health. So how the nutrition is influencing your oral health. So for example, increased frequency of sugar consumption results in increased caries incidence, and increase is greater when sugar is consumed in between retentive forms, particularly between the meals. So this is actually related to the nutrition and how the type of diet you use. And so many studies shows that starch rich, that is carbohydrates food, pose a low risk of dental health. But however, it stands like in a dilemma that, so literature varies, and people who consume high starch and low sugar diet generally have lower levels of caries, is being proved in the literature. Then prolonged feeding and dental caries. So for children, so prolonged contact of enamel with human milk has been shown as a result of acidogenic condition and softening of the enamel, leading to caries. Now, diet and oral cancer. How the diet is influencing and you are getting oral cancer is because it is shown that the risk level of oral cancer decreased with increasing use of dietary products, fruits and vegetables. And but increased with red chilies when you consume, and cereal like Maggi is the main staple diet. So when you use this red chilies, you're more prone to oral cancer. And in a case control study, non-vegetarians are showed higher risk than vegetarian diet. Now, moving to the socio-economic status. The socioeconomic status may represent a measure of personal drive and motivation and may impact on the quality of oral health habits and represent a valid risk indicator. So, despite significant improvements in the oral health of population across the world, it has been reported that lower socioeconomic groups compared to higher socioeconomic groups than poorer oral health. So already we have discussed about this. Then literacy and oral cancer. How literacy is a factor and how it is leading to oral cancer, because there are certain factors like poor socioeconomic status, undernourishment, tobacco habits, poor dental hygiene, which is commonly associated. And in a study conducted in 1994, reported illiteracy and non-vegetarian diet as high risk factors. So all these are from literature where you have to quote it and say this is leading to oral cancer. Now, the next thing is your alcohol and oral health. So there are many studies which is proving the relationship between oral health and alcohol. So effects of oral cavities such as oropharynx cancer, missing, loss of teeth, and great risk of developing periodontal problems. So when you consume alcohol, you're prone more to this. And when you consume this along with tobacco, then it's got a synergistic effect. So it has got worst consequences when compared to alcohol alone. And excessive and constant alcohol consumption may affect host response to infections caused by bacteria. Now moving on to the tobacco and oral health. All major forms of tobacco like cigarette, cigar, pipe, tobacco, smokeless tobacco, everything had a risk factor of oral cancer, cleft lip and palate, periodontal disease, gingival recession, coronal root caries, and delayed healing or impaired healing. So all these are the consequences when you use tobacco. Then there are a few literature saying the relationship between smoking and oral health. In a study in 1998 conducted by Rao et al., stated that predominance of smoking habit was seen in cancer of base of the tongue patients, particularly BD, and chewing habit among the patients of anterior tongue cancer group. So significantly more lesions of the hard palate were detected in reverse smoking group than in conventional chuta groups. So all these literature is proving that there is a close relationship between smoking and oral health. Then there is something which high amount of dental attrition is seen when among beetle squid chewers, and then among the beetle squid chewers you can see hypersalivation, heavy calculus, and eventually loss of periodontal attachment leading to periodontal disease. Then now we are into drug addiction and oral health. So you know what are cannabis and cannabis abusers. So they generally have poorer oral health than non-users with higher DMFT scores, higher plaque scores, and less healthy gingiva. So an important side effect of cannabis is xerostomia. So all of you know when you get dry mouth, what will happen? Periodontal disease, and also there are chances of oral cancer, particularly in the region of mouth, especially in the tongue. Then ecstasy and oral health. So now everybody will wonder what is ecstasy. So that is also a form of drug that's called actually party drug, which also called as Molly. So this is also a drug which causes xerostomia, and this can persist up to 48%. So these condition also you are prone to dry mouth and periodontal disease. And now cocaine. Cocaine, all of you are familiar with. That is also a drug which causes erosion, abrasion, and gingival laceration due to excessively vigorous toothbrushing during stimulation. Also associated with bruxism and dental attrition. Now, the next parameter is stress and oral health, which is a more important thing, because many studies have come that stress is being proved as a, the pH level and everything. Many factors in human body is based on stress, because stress, the release of the hormone is happening and many hormonal changes is happening. So what happens is studies have suggested that pH changes is happening in the saliva when you are stressed. So changes occurring in saliva as a result of stress includes acute or chronic, and which results in periodontal disease and dental caries. So mainly it is actually periodontal disease, because this also induce adverse behaviors like smoking and alcoholism. Then lastly, we are actually moving to the cultural practices and oral health, because mainly now it is related to beliefs and customs, then your cultural taboos. So in that you have tooth mutilations. Tooth mutilation is a practice that have been recorded in inhabitants of non-tropical environments. For example, in Africa and all, there are still places they do practice this tooth mutilations. And this has got non-therapeutic tooth extraction, that is avulsion, breaking of the tooth crowns, then filing and chipping, dental inlay work, lacquering and staining the teeth, placement of gold crowns. And basic reasons for this tooth mutilation is identification, initiation right, aesthetics, and prophylactic benefits. So let's see, what is tooth avulsion? This involves the extraction of one or more permanent teeth, but the practice of deciduous tooth removal is rare and would appear to be confined to parts of East Africa. So mainly this is not practiced in India, it's all in the tribal communities of Africa. And then mutilations of the tooth crown. So the complications of this tooth mutilations include severe pain, unintended tooth fracture, and pulpal exposure and lacerations of the soft tissues. So there are many studies which has been come across and reported that tooth fracture as the most common dental complication associated with tongue piercing. And another complication is loss of tongue sensation, and then tooth wearing or trauma, which is associated with piercing. So let's go for a glimpse of literature so that you will understand more the relationship between whatever we have discussed so far. So now let's see how maternal cigarette smoking and oral clefts is associated. So now you can see mothers of infants with oral clefts. So mothers who smoke during their pregnancy have got a, that their children has got a birth defect either in the form of cleft lip or cleft palate. Then you can see a study. Okay. So now you can see a study, alcohol and oral health, which has got a connection between dental caries and periodontal disease, and alcoholics who neglect themselves with poor oral hygiene and health. So everything has related. And a study conducted by Parvathy et al. Has proved that lifestyle and oral health is associated with dental caries, periodontal disease, and edentullousness. Now let's conclude that lifestyle may be essential explanatory factor connecting oral and general health. It is unlikely that improvements in oral health can be achieved by isolated interventions that target specific behaviors. And the most effective sustainable interventions combined with social policy and individual action through which healthy living conditions and lifestyles are promoted. So, we need a change here. Lifestyle has to be improved to improve our oral health. So these are my references. Thank you for, I know it's like, it's a lot of slides were there. It was difficult for you to follow. So anyway, you will be getting the PPT. If there's any doubt, you can, if you can ask me. if there is any doubt. So thank you so much for your patience.
All right. Yeah, thank you, Dr. Parvathy, I think, for the session. Quickly, I think we'll just like to open the house up for discussions. Any specific questions? Because usually the reason why we picked this topic, like me and Parvati, we decided to go for this is because there's a lot of questions in the recent papers which have coming out of the various aspects. It could be whether stress and oral health, or it could be even the lifestyle related factors, or some scales of measurement there. So this happens to be one of those prominent topics from which a lot of other smaller ones emanate. So, any questions on that? Any of your universities? Since we have a mixed group here, so we've tried to make this as much as inclusive and comprehensive as much as possible. Okay. Yeah, Bharati, could you stop sharing the slide from your end? We'll just open this up for discussion. All right. Okay, so can we have any of the PGs? If you can go ahead, you can ask Parvati any doubts, especially regarding to answer writing or Viva questions.
Good
Yes, Priya.
evening, sir.
Yeah, go on,
Good evening,
Dr. Priya.
ma'am.
Yeah,
Good
please
evening.
introduce yourself and proceed.
Ma'am, I just have a doubt. With the COVID-19, developments and change in lifestyle related to that, or will any new aspect from that side, ma'am, which will influence the oral health?
You mean to ask like, is there?
COVID-19, and because of that, there has been some change in our lifestyles as well, ma'am. Like when it comes some social measures that we've been following, or let it be social distancing, or not being able to attend the dental clinics or dental units. So, and even we don't have the same reach like we had before during pre-COVID time. So, in that way, will what aspect of oral health is more affected because of this pandemic, ma'am, in terms of lifestyle changes?
I got your question. I didn't get your name.
Priya, ma'am.
Yeah, Priya, I think it's basically COVID. What we faced is stress because we are not getting connected. We are not able to work. We are at home. And I think the main aspect of lifestyle, which I come across, is like stress. So, stress induce things like financial matters, whether it could be financial, whether it could be depression, like sitting alone, without seeing your peers. So, all these things have, added up and, lead to a tension kind of thing. So it really affected the lifestyle. So to cope up with that is only self, whether you go for counseling or not, it is all in the mind. You have to, that's a worst situation ever, we come across. We didn't expect such a situation. So you need to handle it by self. Nothing can help you out. Like you need to improve your lifestyle by yourself. That's it.
Yes, ma'am.
Okay. So, COVID associated stress factors, again, that is, I think, equivocally affecting all of us. I think it's how we cope with it. Definitely, it does have an implication because it ends up adding to many of the already pre-existing factors. Just adding a little bit there. Yes, Priya, I think that would take. Okay, thank you. Okay, anybody else? Any of the PGs? I think we have faculty with us. Dr. Krishna Priya is here. Yeah, good evening, Krishna Priya. Would you like to share any thoughts on this topic? Okay. One question from my side, Parvati. When if you're looking at any systematic reviews, which cumulative put together a lot of content, where should we be looking? Like comprehensively, if we could get all the associated factors, be it the hygiene or behavior or psychosocial and stress related. So any references in that regard specifically you would like to recommend?
Regarding the lifestyle, when you Google itself, there are a lot of systematic reviews. So many things I try to include in the reference. So you can just see my references and, see accordingly. But systematic review as in about the lifestyle, it's plenty. Mainly stress. About the oral hygiene, everything, there are being original researches, but when you consider the systematic review, it's all about the stress and lifestyle changes, how you can balance with your oral hygiene changes and all that.
Okay. Is there any WHO special series or bulletin issue on this which you've come across? Because I don't know, I faintly remember reading it somewhere. I don't know, maybe it's related to stress and only oral health, and I don't know if you've come across.
No, I am not
Nothing.
sure. No.
Okay. Okay. All right then. So, any other questions? Anybody else? Please go ahead. I think you can unmute yourself or raise your hand, or you can also put the questions in the chat box. Please give us your feedback as well. Tell us if you like the session, any points, takeaways you'd like to recommend for further learning. Please feel free to go ahead and use the chat box. Meanwhile, I'd just like to take a minute and present a small appreciation to our speaker, Dr. Parvathy, for doing this today. Thank you so much, Dr. Parvathy. I think that's really kind of you that you took out time for this and do this for us, especially because considering that we have a lot of requests from PGs, especially for this topic. So a small token of appreciation from our side. Okay, I think we have
Thank you so much.
Dr. Krishna Priya. Is there? Okay. Okay, then I think quickly, if you could summarize for us, Parvathy, maybe 2 minutes, the take-home message for the topic today, before we can wrap up the session.
Sure. So today session was about lifestyle and oral health. So the main content which I would like the PGs to write is about the 7 parameters we discussed. That is your oral health and behavioral pattern, which includes all your toothbrushing habits, the frequency, the lifestyle, whatever we are implementing to improve your oral hygiene, and also your adverse behaviors like alcohol, tobacco, drug abusers, everything, that relationship, then stress, cultural aspects of this, nutrition. So all together will comprise of this answer. And it's actually an essay question. It's being asked before. I remember during my PG, I got this question, if I'm not wrong. So,
Yes.
there's a lot to write, but basically you need to quote whatever you are writing. You need to, I would love, I will recommend you to quote it where where you read particular, sentence. So that is actually very much required when it's a PG paper. So UG, as far as I think it's not that important topic, but for PGs, it's quite important. And all the resources, you can only see it in the article. So you need to read more article to get more information.
Okay. So that was really very crisp and very concise session today. Thank you so much, all the participants. Please do feel free to reach out to us. You can always write to us for specific queries, whether it's exam-oriented assistance or any exercises, whether it's a practicals or theory. Anything related to public health and dentistry, we'd be really happy to help with our team of educators here. And thank you so much, Dr. Parvathy, for taking out time and doing this for us and all the participants. We'll be sharing the presentation in our student learning groups, and also the recording of this will be available for you for further reference on our PhD 101 YouTube channel. And let's all make learning a PhD more fun and engaging. And thank you all for joining and connecting with us. All of you, please stay safe and keep learning and keep evolving. Thank you so much.
Thank you.